Hello, today's video topic is ulcerative colitis. Ulcerative colitis, the name itself says ulcerative, that means some soreness, some wound kind of thing. Colitis, anything related to the colon, so large intestine. So there is a soreness and ulcer wound in the colon, that's called ulcerative colitis. It comes under the category of inflammatory bowel disease. So your bowel is inflamed, so it causes soreness, wound, ulcer, bleeding. So this is called ulcerative colitis. Usually this can be combined with ulcerative colitis and Crohn's disease. There is a big difference between these two, but today we'll talk about only ulcerative colitis. Usually it happens before the age of 30 years, but it can happen even at any age, but generally 30 years. And what causes this ulcerative colitis? There is no exact reason, nobody knows exactly why it happens, but generally those days we used to say diet, lifestyle, all these things, but these are all now almost nobody is accepting it. But it could be because of the abnormal immune system attacking your own colon, your own body cells. Probably the immune system couldn't recognize your cells, or your immune system cannot differentiate between a virus or bacteria and the large intestine cells. So your own body is acting against your own body. So that means the immune system is attacking the colon cells, large intestine cells. So what happens? So soreness, inflammation, ulcer formation. So these things happens. It's a very chronic disease, and there is no absolute treatment for this, but it can be kept under control. Usually people present, how they present to the doctor, what are the symptoms they may have. The classical symptom is bloody diarrhea, blood in the motion. They will have a diarrhea mixed with motion, is mixed with blood, so that's called bloody diarrhea. Crampy abdomen pain, they will have a squeezing, crampy abdomen pain followed by diarrhea. Even the diarrhea will have some pus cells, because as I told, there are ulcers, wound is there, so the wound, the pus can come. So diarrhea with pus, diarrhea with blood, or even sometimes watery diarrhea with crampy abdomen pain. They will have because of this, they will present to the doctor with anemia, because the blood is getting wasted. So they present to the doctor with anemia, tiredness. So these are the presenting symptoms. And how to diagnose the ulcerative colitis? The first is the surgeon or the physician. They will ask questions as usual, and then they will examine the patient physically. Then they will ask for further tests to confirm the diagnosis. Usually first is stool examination, motion examination. So we can find blood, red blood cells or blood in the stool, and classically there will be white cells. Apart from the red cells, white cells will be present in the motion, and they will ask for a colonoscopy or even a sigmoidoscopy. They will take a biopsy. When they do the colonoscopy, they take a biopsy. The biopsy usually confirms the diagnosis, and to see is there any other complications arising out of this. They may ask for a complete blood test looking for anemia or vitamin loss, because the digestion is not complete, the food is not absorbed, so they will have a vitamin deficiency or anemia. And they may ask for the doctors may ask for a CT abdomen to rule out any other further complications. Usually the further complications, they're looking for any ulcer perforation, hole in the intestine, or tumors, all these things they want to rule out. So they may ask for a CT abdomen. So these are the usual thing. And how to manage the patient. It's a very tricky thing because patients always expect a complete treatment once for all. They take a medicine and they want complete treatment. That is not possible. It will be with them for almost lifelong, and they can control it by their diet, lifestyle changes, medications, and if needed for the complication part, they may require a surgery. So what are the lifestyle modifications? The first thing is they have to relieve their stress. Stress is one of the triggering factors. Stress cannot cause ulcerative colitis, but it can trigger the problems of ulcerative colitis. So stress is the first thing we always say. And then comes the diet part. So in the diet part, usually the physician will say avoid dairy products, milk and milk products, because the lactose cannot be digested easily. They can trigger the diarrhea. And usually the doctors, we always say have a high fiber diet for normal people, but here the fiber intake should be kept under control. In fact, they should avoid fiber diet, mainly vegetables, raw fruits, even any other food with a lot of fibers. It has to come down because already there is a diarrhea, and if you take a lot of fibers, it can trigger the problem. And specifically in vegetables, we always say cauliflower, broccoli, seeds, nuts. These are to be completely avoided because these can trigger the episode of diarrhea. And also you can avoid alcohol. Definitely you want to avoid alcohol, caffeine products, or even any food for that particular person can trigger these things. Then they have to avoid it. So usually undigested or uncooked food can trigger these problems. So what we can do is anything and everything, it should be double cooked. Well cooked food is the best thing, and avoid fiber and dairy products. Of course, alcohol, caffeine, these are the main things for the food part. And of course, they cannot have large meal, or instead of that they can split the food into 2 to 3 times, each meal 2 to times, 6 meal diet. That will be the preferred diet the physicians will advise. And of course, very importantly, hydration is very, very important, because they will be losing diarrhea, not only blood, not only motion, water is going out, electrolytes are going out, so they have to replace the water and electrolytes. This is very important. And once the lifestyle and diet part is taken care, then the physicians or the surgeons may prescribe certain medications like antibiotics. Suppose there is an infection they feel, so definitely they will give antibiotics, or there are drugs which can suppress your immunity, so that your immune system is overreacting to your own body. So with steroids, they may prescribe steroids. There are immunomodulators like certain drugs, cyclosporine, they may give these medications. And when these medications and diet, lifestyle, usually the patients can have a very normal life, but they have to keep a watch on their anemia. They have to keep on watch on their diet pattern. So they are definitely a nutritionist. Definitely the help of a nutritionist is very, very, very important, because if it happens in a child in a growing stage, it can affect their growth. So definitely a nutrition, if the symptoms are under control, your nutrition is very important. And apart from that, what are the other things? If a complication happens with ulcerative colitis, what are the complications can happen? So usually, generally, when they lose blood, they can go for anemia. The pain will be so severe, and the ulcer, the wound, and it corrodes the large intestine. Usually, in the previous videos we got told the intestine and the large intestine are made up of 4 layers. The inner layer, the mucus, the soft one, when it corroded, so they can slough off, perforation, a hole can happen, a big hole or a small hole can happen into the intestine. Your motion can spill into the abdomen. So these are the complications. Then definitely there is a mild increase in chance of getting malignancy compared to cancer compared to the normal population. So usually, according to the age, the surgeons will ask you to go for regular surveillance tests. Some investigations will be done, and the complication is there. Then the part of surgery will be there. So suppose a small part of the intestine may be a large intestine may be cut, an aggressive area, or if there is a perforation, they will cut. Or sometimes the whole large intestine is sometimes has to be removed if the disease is not under control in spite of diet, exercise, lifestyle and medicines. Sometimes we have to remove the whole colon. This is about ulcerative colitis. So ulcerative colitis is nothing but your own body is acting your own colon, causing bloody diarrhea, mucus diarrhea, or even pus in the motion. And part of surgery is mainly for complications. Otherwise, diet, lifestyle changes, and medications. So ulcerative colitis, if it comes, you don't have to worry or you don't have to panic. It can be kept under control easily with the help of a nutritionist, with the help of your physician, and of course the family members' help is very important in this particular disease. Thank you.